Hey everybody, my name is Dr. Caleb Stott. Like many of you watching this video, I actually look online at different implant forums to see what kind of questions people have about implants. This helps me be prepared for the types of questions that we often get in my practice. And just the other day, I was looking and I came across a question that I thought was really interesting. So one poster asked, how did you get used to chewing without feeling? I have my bottoms, and I think he or she means bottom teeth, but just went through upper arch surgery. Not sure why I didn't think about how that would feel. So much I wish I would have known or had been told. So first of all, I'm really appreciative of a question like this. I think it's really difficult to post these types of questions online to really admit that maybe you didn't fully know or understand what was going to happen to you after a surgery like this. And so this person is really brave in trying to ask questions or kind of try to figure out what's going on afterwards. So thank you to whoever wrote this. The level of honesty that we see here is helpful for so many other patients that are going through similar types of decisions, and getting answers to these is very beneficial. In this video, what I'd like to do is address this question. I want to talk about why chewing feels different after full arch surgery or implant surgery. I want to talk about what actually happens to cause the different sensation that this poster is talking about. And then I want to talk about how over time it can get better, because the poster is right. At first, it can be very different, kind of like walking on the moon, I would say. But with time and with familiarity of the situation, things definitely get better. And that's both physically and mentally. The first part of this question is why chewing feels different after implant surgery. And the short answer is that when you lose your natural teeth, you are losing not just the visible part that you see when you smile, but you're also losing what's attached to the roots and the bone, and that's called the periodontal ligament. So the periodontal ligament, or the PDL, is kind of like the springs on a trampoline. They're a part that aren't 100% in place permanently, but they help buffer between the bone and the teeth and give you the ability to feel things through nerve endings that are attached to them, like pressure or biting force or just subtle changes in chewing. Now, when we place all-on-4 or all-on-X or all-on-6 implants, the teeth are no longer attached to those periodontal ligaments. The titanium of implants, as it interfaces with your bone, fuses with the bone, gets rid of any kind of periodontal ligament that would have been there previously, and that's how it gives it its strength to hold your new set of teeth in place. So essentially, an implant is secured directly to the bone cells of your jaw, and that means you no longer feel chewing the same way. The pressure kind of still there, not as strong, and the sensory feedback is much more muted or just doesn't happen to the same degree, or you don't have the same sensitivity to feel it like you did before. So when this poster talks about what they wish they would have known, I think they're alluding to this. We talk a lot about the functional and cosmetic benefits of implants, that they look good, that they function good, that it gives you stability, that you don't have slipping, but sometimes we just don't emphasize enough that it doesn't feel exactly like your natural teeth. Now, when I'm in my consultations that we do free at Smile Now Dentures and Implants, I will often talk about this, and to exemplify my point, I will actually clench my teeth as hard as possible for them to hear. And the reason I do that is because that feeling that you get, that sensation that travels through your teeth and you can kind of feel it in your bone and it stays with you for a while, that's made possible because of the PDL. That's what you lose. So if you're thinking about moving or transitioning into implants and you have the opportunity to save natural teeth, you just have to understand that that is something that you'd be giving up as you make that transition, and it will not feel the same. How to adapt over time. I mean, for a lot of people, they don't have teeth when they start, or their teeth are so badly infected and broken down that these types of things just are not real considerations. But if you had good natural teeth, if you had the PDL intact, how do you get over it with time? So the first thing is time. That's what you do. Most patients will adjust within a couple weeks, maybe a couple months. They'll start to feel things with more sensitivity, more sensation. The brain and the muscles adapt quickly, especially as healing progresses and gets better. The other thing that we suggest is start slow, right? So start with soft foods. Ease your way into more complex textures. Soft foods let you practice chewing without worrying about the pressure and the discomfort while you're healing. The third thing that I would say is practice mindful chewing. So because the feedback is reduced, slowing down, thinking about what you're doing, being conscious and paying attention to how your bite feels and what you're actually doing could be of a big benefit and help your body and your muscles learn what is going on. And then I would say that you could also ask for an adjustment. What this means is that if you really feel like one of your teeth is putting more pressure on things than the others, then you can just go in and ask them and tell them about it. We have different ways to measure your biting force, to look and see where you're biting first. And with that knowledge, we can adjust your teeth so that things are more balanced and comfortable for you as you learn to function again. So what to expect long term? So here's the encouraging part. Even though it feels strange at first, you're going to feel better and you're going to adjust. And especially for the people that were long-term denture wearers, or the people that had teeth where the structure of the teeth was not good enough to last long, and they were looking at transitioning into something that was a better quality of life with a better long-term prognosis or outlook. So even though it feels strange at first, you will adjust. Most of our patients go on to eat things like steak, raw vegetables, nuts. Now you can bite into a carrot. If you want to bite into an apple, these things are going to work out and you're going to be able to do it. And even though the sensation's never exactly like what it was before, if you had fully intact teeth with periodontal ligaments, they feel confident chewing even though the sensation isn't 100% like it would have been had they had their natural teeth. So think about it like this. It's not the same, but it's reliable. It's not natural, but it's secure. And it takes practice and it works. I think that implants are the greatest opportunity to have the same quality of life that you had when you had your natural teeth. You can eat the same foods, you can do the same activities, you avoid the embarrassment or the stigma of having things that don't work out or look bad in public. And that's exactly what you want out of a long-term tooth replacement option. So you're not alone in this. If you're watching this and you're feeling frustrated that nobody told you that chewing would be different and chewing might be difficult at first, you're definitely not the only one. You're also not stuck. We're here to walk through this with you. Every part of this journey is something that we do together with you. If something feels off, if you're not adjusting as quickly as you would like, if you just feel like you need somebody to talk about these things with, that's why we're here. And we have an open door policy at Smile Now Dentures and Implants where anybody can come in, anybody can talk to the doctors that we have, and anybody can get the information that they need. So if you're healing from upper arch implants or even upper and lower arch implants, or you're thinking about getting them and you have questions about how it feels and what to expect and how to make the adjustments easier, then click the link in the description to schedule a free consultation with us at Smile Now Dentures and Implants, where we'll answer your questions and talk to you about all these things so that you're better prepared, that when you do it, that you feel like you made the right decision. I hope this is really helpful for you. If you have any additional questions that you'd like us to answer, drop them in the comments below and we'll see you next time.